I'm Ben Sykes and I'm an Associate Professor in Equine Internal Medicine at Massey University. I'm here today with Wagga and Tatters and we're going to talk about hindgut disease in the horse. When we talk about hindgut disease, it's really important that we focus on the language we use and the terminology. So the term hindgut ulcers has become really popular, but it's actually a misrepresentation of the disease processes, and it's probably something we need to stop saying and really focus on the actual specific disease processes that might be going on in the hindgut. For years we've talked about gastric ulcers, and they're certainly a very important disease condition of the horse, and we shouldn't overlook them just because something's new and go and focus on the hindgut. But we do recognise that there are a range of important things that happen in the hindgut of the horse that we do need to pay attention to, and we definitely need to do more research into to understand at a deeper level what's going on. Again, when we think about these things, we shouldn't forget just because something's old doesn't mean it's not relevant. And so things like worms and parasites stay very, very relevant. In fact, they're becoming more and more relevant as we're starting to see resistance emerge against some of the commonly used drugs that we have in our repertoire. What sort of clinical signs do we see with hindgut disease? Actually, in many ways, it mirrors gastric ulcers. So when we see a horse present with these sort of nebulous behavioural changes, then we think about gastric ulcers, but then we also think about hindgut disease. And if the horse rules out negative for gastric ulcers, then we're going to go and have a look at the hindgut as a secondary source of similar clinical signs. When we see changes in fecal behaviour, so we get sloppy poo, these sorts of things, they're going to point us much more in the hindgut direction very early on, because we don't see those sort of changes typically with disease localised only to the stomach. So when we think about diagnosis, it's important to go through them logically. So a lot of our clinical signs will mirror gastric ulcers, so we need to make sure that we don't discard that. Just because it's common doesn't mean it's not going to be something that we're going to see. In fact, because it's common, it's something we need to make sure we rule out before we make the leap to something that's maybe less common. When we have clinical signs localised to the hindgut, then we may go look in there first. So we need to think about fecal egg counts, looking for parasites. But there's some limitations of fecal egg count. They're good at telling us what type of parasite might be present, and they're good at telling us how many eggs are getting shed onto the pasture. But they're not good at telling us how many parasites are actually inside the animal, and they certainly can't tell us anything about how many larval stages of the parasites are inside the animal. And that's really important because when we think about clinical disease, it's most commonly going to be associated with those larval stages. So what that means is a negative fecal egg count doesn't mean our horse doesn't have worms. We need to build that into the whole diagnostic interpretation of the picture that we're looking at. Things like sand, depending on your geography and where you are, sand is a really important cause of hindgut disease in the horse. And it's something that we need to be clearly and specifically looking for when we have a horse with nondescript hindgut signs. And then we sort of move into a world that's a little bit less clear, a little bit sort of less well defined, and we start talking about this non-specific hindgut disease. We start talking about dysbiosis and changes in fermentation of the horse. We've certainly recognised for a long time that when we feed very high carbohydrate diets, that changes the fermentation patterns of the horse in quite a significant way. And that's due to starch bypassing the small intestine, getting to the hindgut, and then fermenting and producing different strains of bacteria and producing lactic acid in the hindgut. But we're also starting to recognise that even in horses like Wagga and Tatters here, that we have a range of sort of dysbiosis or changes in fermentation conditions that are much more subtle, and we're really only just starting to figure out our way through those now. Sand in specific areas can be really important, and when we think about sand, the only way we can really definitively diagnose sand and say whether it's present or absent is with an X-ray of the abdomen. We have some other techniques that we can use that sort of give us an idea, but if we want to be really sure, then X-ray is the way to give us a definitive answer. And then we sort of get into this nebulous world where we start thinking about changes in fermentation and dysbiosis and these sorts of processes. We don't have good diagnostic tests for that at this stage. There's tests out there that talk about looking for hindgut ulcers, but as we've already talked about, the lesions we're discussing, they're not ulcers, they're not physical changes in the horse's structure, they're functional changes in the bacterial population. And so those tests really, in my mind, aren't terribly useful for looking at trying to understand what's going on a horse here like Wagga. So it becomes a diagnosis of exclusion. We look at the most common things, we rule them out, and then we go and focus on our hindgut health, and we look at things that we can do management-wise that really optimise hindgut health, and that's the critical part of our strategy in terms of treatment. Our treatment of hindgut disease is going to depend on the disease process we think is present. Obviously, if there's parasites present, we need to choose a suitable dewormer. If we've got sand, then we need to treat the horse specifically for sand, and they're specific subtopics for another day. When we think about generalised dysbiosis, what we want to focus on is the overall management of the horse. We want to focus very much on the nutritional management of the horse, and then the sorts of things that we can do to help fermentation. So when we think about the nutrition of the horse, it's very similar to the sorts of nutritional strategies that we talk about in terms of managing gastric ulcers. When we think about management of dysbiosis, it's very similar to our management strategies we talk about for equine gastric ulcer syndrome as well. So we want to focus on really good quality nutrition, and it's an absolute cornerstone. If we don't do that, we can't expect to have good hindgut health. So we're looking at lots of roughage and lots of good quality roughage so that the horse has got a good base for healthy fermentation. We want to think about minimizing the amount of carbohydrate that gets to the horse's hindgut. So feeding high fat, low carbohydrate feeds and being conscious of the quantity is a really important cornerstone of making sure we've got good hindgut health. And that doesn't mean that those feeds, that we can't feed grain, it doesn't mean that we can't feed commercial feeds. It means we need to be conscious of our feed selection. It means we need to be conscious of the amount that we feed in any given meal. In addition to our nutrition, which is a cornerstone of our management of hindgut disease, other things that we can do are look to use supplements or nutraceuticals that have beneficial effects on fermentation in the hindgut. Like the general supplement market, there's a wide range of products to choose from. It can be very challenging. It's really important that we focus on quality. We make sure that we've got products coming from reputable quality manufacturers, because there are wide variances in the quality of manufacturing in that industry. The other thing that's really important is to look at the efficacy of the products and to look for scientific justification or scientific evidence for the efficacy of the products. And that's really important because, as I said, there's an enormous range of products on the market, and we need to make sure that the money we're spending is going to give us a result that we're looking for. A lot of the products contain yeast, because yeast is certain types of yeast are really, really effective at moderating fermentation and providing nice, stable fermentation environments. But it's really important to recognize that not all yeasts are the same. So we can't just take even two yeasts of the same name. It's like comparing a Ferrari and a Mini. They're both cars, but they're going to do very, very different things. So it's important that when we're looking at the science behind our yeast, that we talk about very specific strains of yeast and very specific products. Another thing that comes up when we talk about yeast is, how many yeast are in each dose to the horse, and again, it's like comparing an 8-litre truck to a 2-litre Formula One car. It's not necessarily the size or the amount that's going to matter. It's whether that yeast is specifically fit for purpose and whether it's a yeast that's been studied at the quantity it's being used in the target animal, in this case the horse like Wagga here. Back to the beginning, we need to look at where hindgut disease fits into the big picture. And it's really important to recognise that something like gastric ulcers it's still very common. Just because it's been around a long time doesn't mean we should pass it and go to something that's new and sort of trendy and heavily marketed. We need to go through a logical process and look at a range of different diseases that can be caused. Once we get to the hindgut disease, we need to think about common things like worms and make sure they're not involved. Think about sand, which is important in certain geographical areas. And then we end up into a world of fermentation and dysbiosis, and there it's about really focusing on good quality nutrition and then looking at sensible and educated choices of additional things like supplements that can help us provide a nice stable fermentation environment, which is really important to overall horse health.